Did you know that the food we eat gives our bodies many of the ingredients it needs to function properly? Too much or not enough of specific foods will affect our energy levels, how well we function day to day, and in our sporting pursuits. This can also increase our risk of developing diseases or medical conditions. We can successfully use foods to help us manage our health, our performance, as well as many diseases. My name is Rebecca Hay, and I'm an accredited practicing dietitian and accredited sports dietitian at Zone 34. Stay tuned to learn about what you can do using the foods you eat to make a difference to your health and performance.
Welcome to the introduction for Nutrition for Strong Bones. The goal of this introduction is to highlight the nutritional and lifestyle pillars required to maintain and build strong bones. So why are strong bones so important? Well, our bones are the structures that our muscles and many other tissues attach to, and our bones surround and protect our vital organs. So looking after them is critical for good health. What we're focusing on today is introducing the pillars that are involved with bone health. And along with this comes the goal of preventing the weakening and breaking down of bones, so keeping them strong and healthy and avoiding osteoporosis. So as you can see in this picture, a healthy bone contains a dense lattice of connective tissue. And that tissue is strengthened with calcium and some other specialized bone cells. And you can see next to this is a picture of a bone with osteoporosis. So it's much less dense, so it's weaker, and it increases the risk of that bone fracturing. So to help reduce the risk of this happening, I'm going to introduce the 4 pillars of bone health today. And some of these pillars we are born with and may develop with age or medical conditions. And others we have an opportunity to make modifications to. And we modify them to get a positive outcome for our bones and our overall health. So let's look at some of the risk factors that may be present already or just develop as we get older. And so some of these things we're born with. So looking at our family history, it might be worth checking with other members of your family if they have osteoporosis or have ever experienced a broken bone just from a minor fall or rapidly lost height. Because that can indicate for you that you might be at a higher risk of developing osteoporosis. Our own medical history may also give us a warning for increased risk. So risks increase with things like low hormone levels. So early menopause for women or a low testosterone in men may increase your risk. Gastrointestinal issues that affect the absorption of nutrients like celiac disease or inflammatory bowel disease can also increase our risk. And also the use of some medications can increase our risk of osteoporosis. So if you're on medication and you're concerned, please discuss that with your doctor. So I want to introduce the pillars that we can have an impact on, and I'm going to start with calcium. Calcium is crucial for strong bones, and 99% of the calcium in our body is stored in our bones and teeth. But our bones also act as a calcium bank. So that remaining 1% of calcium is actually in our blood, and what we use it for is the functioning of our heart, our muscles, and our nerves. So the foods that we consume that are rich in calcium will ensure that we have a ready supply of calcium for those functions. If we're not eating enough calcium, though, our body will take the calcium that it needs out of the bank. And what happens then is if we continually dip into that bank, we'll gradually decline our bone mineral density and increase our risk of developing osteoporosis. The next pillar is vitamin D. So why is vitamin D so important? Well, we actually need vitamin D to help us absorb calcium through our intestine. So a vitamin D deficiency can lead to osteoporosis. Now, while we do get some vitamin D from foods, most of it we make in our bodies through exposure to the sun. And in Australia, over 30% of adults have a mild, moderate or severe deficiency of vitamin D. And the final pillar is exercise. And in particular, it's weight-bearing, impact or loaded exercise, so lifting weights. And we know that this can help to maintain muscle strength as an adult, but it can also help to reduce the loss of bone mass. So we have to support these physical activity sessions with food properly, both before and after. So the food will provide us with the ingredients we need to build muscle and bone strength, but also to feel great and healthy. So in the sessions following this, we will elaborate on each of these pillars, and bear in mind these are the ones that you can manipulate and have an impact on. So we will be going into more detail on calcium and how much we need, and how we can meet that need through food, on vitamin D, and how we can get enough through food, but also through safe sun exposure. And in particular with exercise, how to support exercise with the foods that we choose to eat around those sessions.
Thank you for watching. I hope you got some valuable tips from this video. If you want more individualised assistance, please contact the clinic and you can make a face-to-face or a telehealth appointment.